Today we have Jimmy, 24 years old, who presents to the emergency room after a motorcycle accident. His vitals are stable, but his blood pressure is elevated to 156/95. His heart rate is 120 because of his pain. He has an open fracture of his right tibia.
Ah, my leg!
Okay, Jimmy, what is your pain level at on a scale of 1 to 10?
A 10!
Okay, well, I'm going to get some administration of fluids as well as some pain management for you. I'm also going to call in radiology for x-rays.
Hurry!
Hi, my name's Katie. I'll be your x-ray tech today. Can I get your name and date of birth, please?
Jimmy Rolick, December 10th, 1996.
Perfect. We got the right patient. Okay, so first of all, I'm going to use my lead to protect you from radiation. I'm also going to bag my cassette so that we don't get any blood, any other body fluids, or germs on the cassette or the patient. Okay, Jimmy, I'm just going to be taking a few pictures of your tibia and fibula.
Okay.
What I'm going to go ahead and do is I'm going to place this board underneath your leg. I'm sorry. I'm going to place it diagonally so that I can get both joint spaces on here. Next, I'm just going to have you kind of rotate this leg up if you can. If not, we can angle the tube so we don't hurt the patient. Okay, so let's just work on rotating this leg inward. Perfect, that's great. I'm going to use my marker. Okay, and now we have the AP of the tib fib. Now that we got our AP of the tib fib, we're going to need a lateral because in any scenario, we're going to need two views 90 degrees apart. Okay, so what I'm going to have you do, if you're able to, is go ahead and rotate onto this hip so that we get this leg turned over on our cassette here. You're doing great. Now we have the lateral. We're going to go ahead and use our marker again. And this is a good view of the lateral tib fib. Okay, now we're going to look at what we would do if the patient couldn't rotate their leg outward for a lateral. We're going to go ahead and do a cross table. I'm going to lift this board out from underneath your leg there and go ahead and lay it down. What we would do is we would prop up our cassette like this, and then we'd want to use a pillowcase or towels or something to elevate his leg so that we don't get just the bed in the picture and we get the whole tib fib on the cassette. In this case, we would take a picture with the cross beam just like this for a lateral. Okay, Jimmy, now that I'm done with my images, I'm going to go ahead and take this cassette back. We'll dispose of this. I'm also going to take my lead back. I'm going to put up your rails on your bed. And here's your call light. Press here if you need the nurse.
Okay.
And these controls down here, they control your TV.
Thank you.
Is there anything else I can do for you before I leave today, Jimmy?
No, ma'am.
All right, get feeling better.
Thank you.
Okay, Jimmy, the radiologist read your report and it turns out that your tibia is in fact broken. We have placed a cast on it and you're good to go now. If you would sign these discharge papers, you would be good to leave.
Thank you, Dr. Meads.
Thank you as well, Jimmy. I hope you get to feeling better now.
Thank you.
But his blood pressure is elevated to 156/95. His heart. Okay, Jimmy. Is there anything else we can get for you?
Oh, my leg! Ah!
Okay, Jimmy. Turns out your tibia is in fact broken, and we put a cast on it, and I don't know what to say now.